Today, I am here to tell the British people that a future Conservative government will have no greater priority than to protect, support and invest in our NHS. In 1948, the greatest of all Conservatives, Winston Churchill, supported the then Labour government in its plan to set up a National Health Service. He said, disease must be attacked whether it occurs in the poorest or richest man or woman, simply on the grounds that it's the enemy. That safety net that Churchill wanted is our NHS today, supported across the political spectrum. Now, last week, Labour tried to paint a different picture. They know this government increased the NHS budget despite the financial mess they left behind. They know the NHS has more doctors and more nurses than ever before. They know fewer people than ever are waiting long periods for their operations. They know the culture is becoming more caring, but still they seek to trick the public into thinking one party cares for the NHS and the other doesn't. Well, I have a message for Mr. Miliband. It's not a Labour health service or a Conservative health service. It's a national health service. And when my father was cared for by a district nurse, or my wife had our baby this summer, or our son goes to his GP for his jabs, they aren't Conservative patients, Labour patients, or Lib Dem patients. They're NHS patients. And when people in this hall volunteer to support the local League of Friends or join the board of a hospital, we're not Conservative supporters. We're NHS supporters. We all support the NHS because the NHS is there for us all. So don't turn the National Health Service into a national political football, and don't use the NHS to divide us when it's the fabric that unites our nation. This morning, the Prime Minister announced plans to make it easier for millions of people to get 8 till 8 and weekend access to see GPs for their appointments. And I want to start today by celebrating that and some of the other successes of our NHS doing so well despite huge pressure. Take cancer, our biggest killer. Every family in the country has lost a friend or loved one to cancer. I lost my own father last year. It is a ruthlessly indiscriminate killer, whether it targets someone who has just retired after a life of hard work, or a child with a life stretching out of him or her. Now, in 2010, this country had some of the worst cancer survival rates in Western Europe. So we set up the Cancer Drugs Fund. We've transformed cancer diagnosis, so our NHS now tests 1,000 more people for cancer every single day. And so far, this Parliament, we've treated nearly 750,000 more people for cancer than the last Parliament. That's thousands of lives saved, thousands of families kept together, thousands of tragedies averted. So let's hear it for our brilliant cancer doctors and nurses. Or look at dementia, one of the most terrifying conditions of all. I'll never forget the courage of a man I met with dementia who single-handedly stood up to the banks and demanded they gave him an alternative to having to remember a PIN number. But it isn't just your PIN number that goes. It's precious family memories, marriages of many years, relationships with children, all snatched away by cruel tricks of the mind. When we came to office, fewer than half those with dementia got a diagnosis, meaning many missed out on vital medicine or support for their family. We've now diagnosed 80,000 more people. The Prime Minister hosted a G8 summit to get the drugs companies to do more to find a cure. And we're working with the Alzheimer's Society to enroll 1 million dementia friends to tackle stigma, with 500,000 signed up so far. So let's hear it for our GPs, dementia nurses, dementia carers, dementia friends, people with dementia who are changing the way we deal with this horrible condition. Or A&E, the critical front line for our NHS. A young A&E doctor once told me how she cried on her shift after seeing a 90-year-old man say his goodbyes to a 90-year-old woman he had been married to for over 60 years. For her, that was just part of the job. And with 1 million more people using A&E every year, the pressures on her and her colleagues are immense. Sometimes, yes, it's been tough meeting the target. But despite that, we've halved the time people wait to be assessed. We're treating nearly 2,000 more people every single day within the 4 hours compared to 2010. So let's hear it for our brilliant A&E frontline staff now preparing for a challenging winter. Conference, our opponents say the NHS is in decline. But as we've just heard, according to the Independent Commonwealth Fund, under this government, the NHS became the top-rated healthcare system in the world, better than America, better than France, better than Germany, better than Australia. And the way the NHS rose to the challenge of Ebola says it all. 164 NHS volunteers offering to go and help contain the outbreak in West Africa. So let's hear it for all NHS doctors, nurses, porters. And I don't want to forget the cleaners, the caterers, the carers, the volunteers, all of you. You are the best of British and the pride of our nation. But that doesn't mean that things are perfect. About the first thing I did as Health Secretary was to read the original Francis report into the terrible things that happened at Mid-Staffs Hospital between 2005 and 2009. I was utterly horrified. As Francis made clear, system-wide failings meant these problems weren't limited to one hospital. One member of the public wrote to me about what happened in another hospital. In a letter that was so shocking, I asked to meet her. She told me she visited her late husband in hospital at 5 in the morning and found him naked on a deflated mattress, caked in urine and excrement, curled in a fetal position, with a cold air conditioner blowing directly onto his body. She still has nightmares about that visit. Now, that story, thankfully, is far from typical of our NHS. But I vowed that day, if I did nothing else, I would make sure I returned a culture of compassionate care to every corner of our NHS, because caring is what the NHS stands for, what every doctor, every nurse passionately wants, why it was set up, and what a quagmire of targets, goals, and plans have too often allowed to be squashed. Supported by a wonderfully committed ministerial team, Freddie Howe, Norman Lamb, Dan Poulter, Jane Ellison, and George Freeman, we're changing things. We've introduced, as we've just heard, a tough new inspection regime. Since then, our hospitals have hired over 5,000 more nurses to tackle the scandal of short-staffed wards. 5 hospitals, Basildon, North Lincolnshire, George Eliot, Buckinghamshire, and East Lancashire, have been put into special measures and turned around. And patients are saying that they're treated with dignity and respect, not just at Mid-Staffs, but across the NHS in the highest numbers ever recorded. Indeed, on Friday of last week, the CQC announced the first hospital in the country to get an outstanding rating, Frimley Park in Camberley. Chief Executive Andrew Morris is so committed. He's been there for 25 years, and his son even works there as a porter. So well done to everyone at Frimley Park. Now, the problems of poor care, highlighted by Robert Francis, happened under Labour. So I thought Labour would rush to support me in sorting them out. In fact, they did the opposite. They said talking about poor care was running down the NHS. They even tried to vote down the law, setting up a new chief inspector of hospitals. I'll tell you what running down the NHS is. It's not learning the lessons when a mother's forced to give birth on a toilet seat, as happened in 2007, ignored by Labour, being sorted by us. It's making hospitals foundation trusts when their mortality rates are too high, brushed aside by Labour, being sorted by us. It's stopping the CQC telling the truth about blood-stained floors in one hospital. Happened under Labour, stopped by us. It happened in England before, and it's happening in Labour-run Wales today. So don't you dare talk to us about running down the NHS, because for Labour, good headlines about the NHS matter more than bad care for patients. And in our NHS, nothing matters more than patients, and whilst I'm running it, nothing ever will. I simply say this to a Labour Party that still refuses to learn the lessons of poor care. Until you do, you are not fit to run our NHS, and if you won't put patients first, we will, and it will be the Conservative Party that completes Nye Bevan's vision for an NHS that treats every patient with dignity and respect. We will finish the job. I could go on with my concerns about the culture Labour left behind in our NHS. But I want to look forward and deal with one of the biggest concerns that people have about the NHS, which is its funding. Labour talked about putting in more money last week. But securing the NHS budget isn't about an extra billion here or there. It's about funding over £100 billion, which is what we spend on our NHS every year. And that needs a strong economy. Because it's very simple. You can't fund the NHS if you bankrupt the economy. This Parliament, we've actually increased spending on the NHS by more, in real terms, than Labour promised last week. We've done it because of David Cameron's personal commitment to our NHS and difficult decisions taken by George Osborne. Other countries followed the Labour way. They ducked those decisions. They had no plan and ended up cutting their health budgets. Italy by 3%, Greece by 14%, Portugal cut its budget by 17%. I don't want that to happen here. So never forget, we've just had the greatest squeeze on finances in NHS history because a Labour government lost control of our national finances. And to anyone worried about investment in the NHS, I say this: a Labour government with reckless economic policies is the biggest single danger to funding our NHS. Do not take that risk. Nor should we forget that every penny of NHS funding comes not from the government, but from the pockets of hard-working taxpayers. So if we increase spending on the NHS, we must also be able to look at every single one of them in the eye and promise that every penny is being spent wisely. Which means we mustn't stop new ideas that come from outside the NHS, whether from charities or, yes, from the independent sector. Labour call this privatisation. But using a charity like WizKids to supply wheelchairs to disabled children, or using Specsavers to speed up the supply of glasses, is not privatisation. When the last Labour government used the independent sector to bring down waiting times, that wasn't privatisation either. So stop scaremongering about privatisation that isn't happening. It nearly cost us Scotland, and we won't let it poison the debate in England as well. Secure NHS funding, backed by a strong economy, is the foundation. But the building blocks to a modern health service are two things that need real cultural change. Personal care, something that's a real challenge when patients navigate one of the biggest organisations in the world. And personal control, in a world that's too often said, the doctor, not the patient, knows best. I remember when I did a shift in an A&E last year. A 90-year-old lady with dementia was brought in by ambulance after a fall in her care home. She was completely motionless. She couldn't talk. She couldn't feed herself. She couldn't even drink a glass of water. What made it worse was that in that A&E, we knew next to nothing about her. We didn't have her medical record. We didn't know her allergies. We didn't know if she was normally able to talk or whether it was just because of the fall. To us at that hospital, she wasn't just unknown, she was anonymous. How could we possibly give her the personal care that she desperately needed? And the same could happen to any one of 500,000 over 90s we now have in our society. And it could happen to anyone with long-term or a mental health condition, any one of whom can find themselves pushed anonymously from pillar to post in a system that doesn't know who they are. For me, the point of the NHS is to make sure that everyone gets truly personal care from people who know about them, know about their condition, know about their care plan, so that what happened in that A&E never happens. As a first step, that needs the integration of the health and social care systems. And this year, for the first time, that's happening. 150 local authority areas working together with their local NHS on their better care plans to pool commissioning, reduce emergency admissions, share medical records, all starting from next April, and many of you in this hall have been involved. But truly personal care means more than joining up two big systems. It means personal, responsive care from your GP too. Last year I manned the phones in a busy London GP practice. The doctors there worked very hard, but what was frustrating was having to tell nearly every caller there weren't any appointments available for 2 weeks. We urgently need to make it easier for busy working people to get an appointment. That means more GPs, so I can today confirm plans to train and retain an extra 5,000 GPs. But it also means new ways of working. Now, last year we announced plans for 7.5 million patients to get weekend and 8 till 8 appointments. Today we've announced that we're rolling that out to millions more, meaning that the service will be available from next year to a quarter of the whole population. But going even further, I commit that at the end of the next Parliament, a Conservative government will make sure that every NHS patient across the whole country will be able to get weekend and 8 till 8 appointments. But personal care isn't just about a convenient appointment. It means talking to a doctor who knows you and your condition. Astonishingly, in 2004, Labour abolished the requirement for every patient to have their own named personal GP. At a stroke, many patients were told they no longer had their own GP, but were merely attached to a surgery. And GPs were told they were no longer personally responsible for individual patients. And if you have a chronic condition or complex needs, continuity of care is absolutely vital. You don't want to have to explain everything about yourself over and over again. And you want a doctor who takes ongoing responsibility for sorting things out, not just that day, but every day. So last year I changed that back for over 75s by insisting they get a GP named on their medical record responsible for their care. Today I can go further and announce that in the new GP contract for 2015, every single person in England will go back to having a family doctor named on their record responsible for their care. Personal care for every NHS patient. People want personal care, but in the 21st century they want something else. Not just personal care, but personal control. People with diabetes or a heart condition or recovering from a stroke say the best person to take control of your care isn't actually your doctor, it's you. And right now we make that far too hard. We don't give people enough information. So this summer we became the first country in the world to publish detailed information about safety, waiting times, patient experience, food for every major hospital. And on the new MyNHS website we'll go even further. But it's not just information about your local hospital you want, it's information about yourself. So today I can confirm that by April next year, every patient in England will be able to access their own medical record online, the first country in the world to take this huge step. It means you will no longer have to pay to access your medical record. You'll be able to see it and show it to anyone you choose. You'll find it easier to do detailed research about your condition and easier to challenge decisions. Because the boss isn't the doctor, it's you. Nothing about me without me. Personal control of your health delivered by this government. Conference, my vision is simple. We in this party have always believed passionately that we should honour our debt to previous generations. So I want Britain to be the best country in the world to grow old in. I want us to enjoy the fruits of our prosperity, yes, but never forget the people who've worked before us, who've worked hard to make that possible. Never forget that all our success, all our strength, all our wealth as a country is but a hollow dream if at the end of it we're not able to give all our citizens the healthcare and support they need in old age. Never forget that it's not a choice between a strong economy or a strong NHS. You need both, and only one party, this party, can deliver both. A strong NHS, a strong economy, from a Conservative Party proudly rebuilding a strong country, personal care, personal control for patients treated with dignity, compassion and respect, delivered by our party for our NHS, for our country. Thank you.